This presentation was first delivered in November 2020 as part of the Time to Change Employer Masterclass on mental health policy. We hope you find it useful. So before I hand over to our guest speaker, Stephen, today, I just wanted to touch on the subject that we're talking about, mental health policy, because it is an important subject. And it's one that certainly from my experience working with employers through their action plan, is something where there's not often the most confident approach to it. And I don't know exactly why that is. Maybe it's the legality around it and that side of things. Maybe it's just a lack of guidance in terms of the right way to go about it, which is partly why we have the masterclass today. But there is a phrase there up on, or a quick sentence there up on that slide. So a clear mental health policy establishes a framework for everyone to work within and shows new recruits and current employees that your organization takes their mental well-being seriously. So we know mental health policy is quite complicated. It sounds very, very simple, very straightforward when we condense it into a nice, concise sentence like that. But try to just deconstruct that a little bit with 3 points on the slide there. The first one is why policy matters. And then we've got creating a mental health policy and the importance of policy review. And these are things that I think Stephen will cover in his presentation. But I just wanted to talk very briefly about how they factor into the Time to Change employer pledge and more specifically the action plan. I'm just going to share on the chat feature now actually a guide to core standard 4 in the Time to Change employer action plan. So that should be in the chat box now. If not, I'm going to share that with Runa and hopefully she can share that with you. But do check this out after the presentation. It's a really kind of concise breakdown of how that might be able to help you. So first of all, why policy matters. Really what we ask employers to look at here is how your policies can be created or amended to encourage those with mental health problems to come forward. So it's really using your policies as a tool to help your organization further address mental health stigma within the organization. Creating a mental health policy. So some organizations may opt to create a standalone mental health policy, and obviously that has its advantages. That's not going to be the case for all employers, for all organizations, for practical reasons, for logistical reasons. So where that's not the case, what we ask employers to do is look at how mental health and well-being can be embedded within your existing policies across the organization and make sure things are covered off that way. However, one of the things, as I say, that we do ask employers to think about, which is applicable to either scenario, is to involve other people from your organization in that process. So I suppose predominantly policy would sit within the remit of perhaps your legal team if you have one, your HR team, or perhaps the senior leadership as well. But there's no reason why other people from other employees from across the organization can't be involved in that process. So as an example, your workplace champions or your mental health first aiders, or your well-being network, whatever you choose to call that group of people, if you have that in place, there's no reason why they can't be involved in that policy process as well, including those with lived experience of poor mental health who potentially will be directly impacted by those policies can also be a good idea. And then on that note, the importance of policy review. So what we're talking about here is the importance of looking at existing policies and reviewing these to understand whether they need to or already include mental health and well-being for staff. So, I mean, we only have to look at this year. 2020 so far has been interesting, to say the least, and ever changing, and we've really had to adapt a lot of our ways of working. And I think for me, that's kind of instrumental of the importance of looking at our policies and how they can support employees as your organization grows, as external factors and environmental factors affect how we work. So our guest speaker today is Stephen Heath of Mind, I'm delighted to say. Stephen is a lawyer who works within Mind's legal team. He's also an employment specialist who has considerable experience working with a wide range of employment work. And before working with Mind, he was a barrister who appeared in tribunals on behalf of both claimants and respondents. So therefore has experience from both perspectives and both sides of the fence, if you like. Stephen also used to act for employers large and small, including multinationals and a number of public sector organisations such as local authorities, police constabularies, NHS trusts and the Crown Prosecution Service.
Yes, good afternoon, everyone. Thank you for that introduction, Ian. I'll be talking about creating and developing a mental health policy. So in terms of what I'm going to cover today, first of all, very briefly, it sounds a stupid question, but I'm going to look at what is mental health. I'm going to examine why an organization should consider having a mental health policy. I'm going to look at the legal framework. I'm going to look at perhaps some practicalities about creating a mental health policy. I'm going to look at the issue of mental health within other policies rather than a standalone policy. And I'm going to touch upon the question of policy review. So first of all, what is mental health? And what I've put up on the screen there is the World Health Organization definition of mental health. Mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively, and is able to make a contribution to his or her community. I think the reason I put that up is just to focus attention on the fact that we're not just dealing with poor mental health or mental illness when we're talking about policies. We're talking about the holistic mental health. We're talking about well-being, as well as what an employer might do when an employee is experiencing poor mental health. At Mind, we often say we all have mental health, which we do. It can be good mental health, bad, and it can be changeable. So I think the first thing I'd say about mental health is don't just focus on one aspect of it, but mental health as a whole. So why should an organization consider having a policy? Well, the first reason is simply the sheer prevalence of mental health. I was mentioning to Ian last week that a friend of mine works for an investment bank, and they have a gun policy. Would you believe it? They entertain lots of rich people from United States and other places, and they take them up to the grouse moors of Scotland. So people do bring in their shotguns to work, and they have a policy on how they're stored. Now, with mental health, you'll be using that much more than any gun policy. The fact is that 1 in 4 of us in any year suffer from a common mental health problem. And there's some research out there from business in the community which suggests that 3 in 5 during their working life will have had a mental health issue due to work. So it is mental health is an issue which you will certainly have to engage with, simply because of the prevalence of mental health problems. The second reason is that the workplace has potentially a major impact on mental health. We derive self-esteem from our work. It gives us a sense of identity. We form social networks, and we spend a lot of time. It is a protective factor against poor mental health. And when things go wrong in the workplace, it can have a major detrimental impact on our mental health. I think another reason why we might want to have a policy is simply the complexity of mental health issues. Poor mental health can have a variety of causes, both inside and outside the workplace. And there are varieties of expression of both good and poor mental health. The other issue many of you might be aware of is that when things go wrong, it can be very challenging indeed. Ian mentioned beforehand that I've acted for employers and employees over a number of years as a barrister. I would say the most difficult cases I've ever done in terms of the employment cases have been those which involve a mental health component. I'm thinking of one particular case that I did a number of years ago, where one particular employee with a fairly serious mental health problem, very poorly managed, created havoc within an organization. So as I say, it can be very, very challenging indeed. It's potentially costly as well. Deloitte's produced a report this year in which they estimated the cost of poor mental health to UK businesses was £45 billion per year. So, I mean, that's the whole UK economy, but individually, businesses can suffer greatly if they from the fallout from mental health issues. Then there's also the human cost in terms of poor morale within organizations, absenteeism, presenteeism, and the fact of the matter is that businesses wouldn't exist without people. Finally, there's the question of stigma, which Ian touched upon in his introduction. This is a vital issue, as I'll turn to the law shortly, but I wish I could remember, I wish I could find this statistic, but I came across a statistic a number of years ago where it was suggested that 80% of employers would not employ somebody if they knew that they had depression and that they could get away with it. A more reliable statistic, one that I came across from Ireland, is that 50% of workers either haven't or wouldn't disclose a mental health problem to their employers. And I think this is the reason being the fear and the perception of discrimination and what it might mean to the employment relationship. In terms of the legal issue, the importance of stigma and lack of disclosure is that there are two key protections within the Equality Act, which are dependent upon the employer knowing of the employee's disability. So if an employee is not disclosing a disabling mental health condition and suffering in silence, then they're not getting valuable protection under the law. In terms of perhaps why specifically have a mental health policy, again, there are a number of reasons here. I mean, the first one is that it enables an organization to communicate both to itself, to its employees, and to the outside world, its organizational vision. We are an organization that supports people with mental health. We are an organization that prioritizes these things. We are an organization that takes these actions. Secondly, it facilitates conversations about mental health, and Ian was mentioning the Time to Change pledge. How do your policies support those persons with mental health problems and support them to come forward and disclose? Well, the mere presence of a dedicated mental health policy is a step in that direction. Especially, as I was saying, if it communicates the sort of values that embolden, I suppose, people to start talking about the issue. I think thirdly, mental health permeates numerous organizational areas, from recruitment to the at-work policies to such things as organizational change and redundancy. It promotes consistency and effectiveness. It provides a framework whereby people can know what the organization's values, priorities and actions are, and they can act accordingly. It can provide a repository of good practice. I mean, let's face it, nobody is a born fully fledged expert on mental health issues. Obviously, there are some people within organizations who have fantastic emotional intelligence and experience, and perhaps lived experience of their own of mental health issues, who are absolutely fantastic, but not everybody is. So it helps if there's something there which can be a source of assistance to everyone. All in all, a policy can contribute towards creating a safer and more positive workplace and go towards creating a culture whereby people feel that their mental health, they can thrive within the workplace. Ian showed that quote earlier at the beginning. I've got one of my own. I haven't put it up there, but I'll read it out for you. And it's from an Irish organisation called Sea Change, who are an anti-stigma organisation. And what they say is this: a mental health policy is not an overnight panacea. However, a mental health policy accompanied by clear operating procedures and underpinned by lived values removes uncertainty for employers and employees, brings mental health into the mainstream of work, and provides a framework so that everyone knows how the organisation views and deals with mental health in the workplace. If anybody wants that quote, I'm sure that we can disseminate it later. But I thought, you know, that says it as well as I ever could. So rather than steal it, I'll read it out for you. Right, let's look at the legal framework. First of all, there's the Equality Act. Last year, Mind carried out a survey of 1,700 people about employment issues. And one question they asked was effectively, did you know that a mental health problem could amount to a disability under the Equality Act? 49% of people didn't know that a mental health problem could in law amount to a disability under the Equality Act. I've got to say that absolutely staggered me. I mean, in the definition of disability under the Equality Act, it actually says in terms of physical or mental impairment, but even so, people didn't know. The first legal issue, I guess, is if an employee has a mental impairment that has a substantial long-term adverse effect on their ability to carry out day-to-day activities, then that person qualifies as a disabled person in the eyes of the law, and as such enjoys certain protections. The first of those being that if a disabled person is at a disadvantage within the workplace, they can ask the employer to make reasonable adjustments. And that is a vital bit of protection under the law. And this is one of those bits of protection that I was talking about earlier, that it's dependent upon disclosure. An employer is not subject to the duty to make adjustments unless it knows or reasonably ought to have known that the employee rather was a disabled person. So this is one of those issues that I was talking about, where the stigma and the fear of discrimination, which causes an employee not to disclose their mental health problem, actually diminishes their protection under the law, because the employer is not obliged to make adjustments unless they know or ought to reasonably to know. The second protection is protection from discrimination. And certainly one particular type of discrimination is called discrimination arising from disability. And this is not the type of discrimination where I treat you less favorably because of your particular disability. It's about the consequences of disability. So if you're a disabled person and you take time off work and I sack you because of the time you took off work. But that time you took off work arose from your disability. Now that's another type of discrimination, which again is dependent upon disclosure. So if the employer doesn't know or can't reasonably have known about the disability, then the person is unprotected. In terms of the Equality Act, there are other types of discrimination which potentially are relevant, race discrimination, sex discrimination, etc. And I suppose the reason I raise this is consistency. If you treat somebody inconsistently as an employer, then you may open the door to discrimination. So, for example, if I let Jack, a man, take time off to go for counselling, for example, and I don't let Janet, a woman, take time off, then the disparity in treatment, what's the reason? It potentially opens the door for discrimination. Next, there's health and safety legislation. Basically the health and safety legislation arose from quite old Victorian legislation about factories and shipyards. It's largely geared towards physical rather than mental issues. But in terms of the Health and Safety at Work Act, the obligation on the employer is to ensure, so far as reasonably practicable, the health, safety and welfare at work of all of their employees. Health is health. I mean, it's mental as well as physical. And employers should conduct their undertakings in such a way as to ensure, so far as reasonably practicable, that persons not in their employment who may be affected by the employer's undertaking are not thereby exposed to risks. That's less relevant. And employers must reduce the risk so that it is as low as is reasonably practicable. Under health and safety legislation, the employer is under obligation to look out for the employees' mental as well as physical health. And there are other obligations under different regulations to make risk assessments and to make appropriate arrangements following those risk assessments. In terms of health and safety legislation, the Health and Safety Executive is the body that enforces it. I think I'm right in saying that they've never undertaken a prosecution in respect of mental as opposed to physical health. However, they do have some interesting guidelines about workplace stress. And perhaps I'll just flag them up. They're called the management standards. And they talk about such things as employers should look at the demands on the employees, such as workload, how much control employees have, what support employees get, looking at positive relationships within the workplace, making sure people understand the role that they have, and looking at how organizational change and such things are communicated to employers, because these are as it were, the flashpoints which give rise to workplace stress, and workplace stress is something which can have a damaging effect on people's mental health. There are other employment law issues. I won't go into them, but basically there are issues such as flexible working, unfair dismissal. Okay, let's move on to creating a policy, and what sort of things that should you be thinking about when you're looking to create a policy. Now, one vital thing that is what is necessary when you're creating a policy is to have senior leadership buy-in. Ideally, this would be a champion with lived experience, but needn't be, but somebody who gets it, basically. Secondly, staff involvement is crucial. Engage with staff. There are a number of ways to do this, depending on what sort of and what size organization you are. You could have consultations with staff about mental health issues. You can have surveys, meetings, form committees, etc. But the idea is basically to capture what the current attitudes within the workplace are and what issues need to be addressed within the policy. Thirdly, coordination is crucial. your organization undoubtedly will have other policies, performance management, absence management, all sorts of things like that. There will be mental health related issues, we'll come onto this later, but which are touched upon in those. And obviously what you don't want is one policy saying something and another policy running in the opposite direction. There's also a need to assess what the needs are and collect data. And obviously we talked earlier about the staff involvement. This is a crucial way of assessing what the needs are, but isn't the only one. And after that's done, you can develop your policy from this learning. It's not an overnight thing. It'll likely involve a significant amount of work and possibly professional assistance from outside. And also, when you create a policy, it's absolutely vital to assess its impact and to review it. And we'll come on to that a little bit later as well. Okay, so what about the contents of the policy? I think the first point to make is that this isn't a one-size-fits-all. Otherwise, you know, why bother having events such as this? You can just download a template off the internet, which you can as it happens. But to create a decent policy, you have to tailor it to the needs of your organization. And in terms of what that policy might want to say, I've looked at a few on the internet and sort of tried to draw out certain themes as to what a policy might want to cover. One is communicate your aims. So one example I found, to create a workplace culture that promotes and supports the health and well-being of all staff. So just basically have a think about what it is that you're trying to achieve and articulate that as an aim. Have several aims. Secondly, you might want to articulate what the organization's values are when it comes to issues such as mental health and such things as respect, equality, dignity, etc. Articulate these within the policy. Also, something that I've seen in a number of policies is articulating commitments that an employer wants to commit to writing. One example I found, promoting positive mental health, helping those experiencing mental health to recover. So set out what it is that you will do for staff. What objectives the policy has. Some examples here, to comply with legislation. One would hope that almost goes without saying, but I've certainly seen that. Raise awareness of importance of promoting mental health in the workplace. Also setting out responsibilities. Whose responsibility is it to take this particular action? Who has general ownership of the policy itself? Now, perhaps condescending to a little bit more detail, as I said earlier, there are numerous templates out there which you can tailor to your organization. But certain features seem to be cropping up in a number of policies I've seen. Articulate how you will promote the well-being of staff, how you will tackle the causes of poor mental health. And it may be that you find the health and safety executives management standards are useful here because they set out what are certainly stress points within many organizations. So your engagement with staff is important here because it will inform you of the causes that you need to address within the policy. Again, engagement is crucial for the next one. A policy may choose to show how it will take action to support staff in certain circumstances. Also, how the policy seeks to create a positive culture within the organization. Also, policies often are specific about which elements of the employment relationship they apply to. They might signpost out to other policies, areas such as recruitment, making reasonable adjustments, retention, redundancy, various things like that. A policy also might explicitly set out the legal responsibilities so that both managers and staff know exactly where they stand in terms of the legalities of the situation. Then there's the question of policy review. I mean, it's unlikely that you will get a policy that runs like a Swiss watch first time of asking. It's more likely that there might be some teething issues and that you might want to revisit and amend your policy. But I suppose the important thing is to find some way of measuring the effectiveness of the policy review. And in terms of its effectiveness, perhaps, again, that sets out the importance of articulating the aims of your policy. And you may well want to put in some smart objectives within the policy, which can give you some metrics which you can work with. Number of staff complaints, sickness absence levels, staff turnover. Measure the effective by asking staff explicitly about the issues that arise. This will allow you effectively to review your policy and see if it's working for your organization. It is probably a good idea to set a date for a review of your policy. How long's a piece of string? Well, maybe 6 months and maybe every year thereafter. Obviously, if you've set a review of 6 months and you realize that you need to rip it up and start again, you might want a fairly swift review after you piece it back together again. And again, in terms of policy review, involve your staff again. Don't just engage at the beginning and then drop them. Use them to assess how effective the review is. Now, turning to mental health within other policies. I said earlier that mental health is complex and it can permeate various aspects of an organization's functioning. And in terms of specific policies, absence management obviously is a key one here. Most organizations will have their policies on how they deal with staff absences. They often will have triggers for stage 1 meetings, stage 2 meetings, or what have you. They will set out timescales for which will indicate how procedures will run. And obviously, poor mental health is a major driver of sickness absence. So mental health, it may be that you would want to have a specific mental health element within an absence management policy. Performance management, that again is a key one in terms of mental health. A number of the cases that I did, disability discrimination cases relating to mental health, had a performance management element at their heart. And basically it was when underperforming members of staff were basically very badly managed under performance management procedures. And don't forget supervision and appraisal as part of this, because one potential flashpoint is the way people are supervised, the sorts of the things that they are set. I'm trying to think of the word and I completely forgotten it, but disciplinary. Now, quite often disciplinary procedures cover both conduct and capability, either of which mental health can be an issue. People can commit acts of misconduct because of pressure that they're under, because of their mental ill health. People's performance at work can suffer because of their mental health problems. So an awareness of this within the context of disciplinary procedures is vital as well. Health and safety policies, we've touched upon that already, but mental health should, and stress management especially, should be key features of those. And I've put here potentially any and every policy. The reason for this is because of the duty to make reasonable adjustments. What the Equality Act says is that if there is a provision, criterion, or practice which puts a disabled person at a substantial disadvantage in comparison with a non-disabled person, then that potentially triggers the duty to make adjustments. And a policy, or the application of a policy, any policy, can fit within that provision, criterion, or practice. So potentially any policy that an organization has might be susceptible for adjustment under the Equality Act if the application of that policy is disadvantaging somebody with a disability. Finally, just the obvious point that policies are only as good as the people who implement them. You can have the best policy in the world, but if it's operated by tyrants, then obviously this won't be good for the organization. Also, embed policies. I imagine one key element of this is training managers in how to apply them, training managers in how better to spot mental ill health. And finally, I say the importance of training. And I'll leave it there because that's probably another Time to Change masterclass that I've trailed there. Thank you very much.
Thank you very much, Stephen. Let me just see if I can take back the screen sharing from you. Here we go. So as promised, there's an opportunity for some questions and answers now. We did have one question come in earlier, although it looks like it may have been answered by another participant, but I'll read it anyway. So the first question is from Katie Mullins, and it says, is it up to the employee to identify themselves as disabled in the case of depression and anxiety? We have 1 or 2 employees receiving medication for this, but they say that they don't know if it means they have a disability. And then I mentioned we have an answer for that. Sue Ollis has gone on to say, a mental health condition is considered a disability if it has a long-term effect on your normal day-to-day activity. This is defined under the Equality Act 2010. Your condition is long-term if it lasts or is likely to last 12 months. So it sounds like a comprehensive answer. I don't know if you wanted to add to that, Stephen.
I will add just one little thing. Excellent answer, Sue. Also, if your condition, if the effects of your condition have stopped, but are likely to recur, then you can also be considered a disabled person, because a lot of people will, you know, their condition is fluctuating. So they're feeling absolutely terrible, but then they get better. If their condition is likely to recur, and likely in this context just means could well recur, then it's a disability. The other issue, the other thing that I'd add is when considering whether or not a condition is a disability, you ignore treatment. So for argument's sake, if that person with depression is taking antidepressants, having counselling, and their functioning is back to normal, they could still be considered a disabled person if without that treatment, their functioning would be at a lower level. So that's all I'd add to that, but cracking answer, Sue.
Perfect, thank you very much. We don't have any questions as yet, or actually we do. Claire has just asked a question, which is, could you please give us an example of what you would put in an absence policy?
Difficult to answer because I mean, I've seen some absence policies which are 50 pages long, so it's difficult. I mean, in terms of mental health, one thing that occurs to me, given that startling to me anyway, thing that our Mind survey showed, given that 50% of people that we surveyed didn't know that a mental health problem could amount to a disability, that's one thing that I'd put in, just so that people know that. So off the top of my head, that's one thing.
Thanks, Stephen. And Claire's just gone on to say that these are normally negative, i.e. to support the company and not the employee. And Claire, I know where you're coming from there. And I think George actually has made that point earlier in the chat. He says, I agree, generally the policy should also be to reflect we are doing things because they are the right thing to do, in line to the organization's values, as well as the fact that there is a legal obligation, which is a really good point, I think.
Yeah. I think sometimes businesses do need a business case to be made, but I think it's refreshing that a lot of businesses do seem to be taking the attitude that they can't run without human beings, and therefore they are doing the right thing because, as George said, it's the right thing to do. So,
The other thing that I really liked in your presentation, Stephen, that you covered is that you considered your policies covering the entire life cycle of an employee. So not just slotting in there in the middle for your existing workforce, but considering everything from the recruitment phase and then the induction phase, your core workforce, and then out through however you might leave the company through redundancy or another channel. We have a question from Emma. So underperformance and mental health is a live challenge currently. When the job tasks together with lockdown are exacerbating an existing mental health condition and mean that they are unable to perform the role, how much reasonable adjustment do you need to make before it becomes a different job?
Great question. Well, the way what the Equality Act says is that if there is a provision, criterion, or practice, and that can be the way in which a job needs to be done. A job description, for example, can create a provision, criterion, or practice. If that is causing a disabled person to be put at a substantial disadvantage, then the duty is to make reasonable adjustments. So there's sort of plenty of sort of elasticity in that definition. So the first question is, consider what it is about the requirement to do the work that is putting the person at a disadvantage because of their disability. So it's not a question of I am a disabled person, I'm having a hard time, give me adjustments. They are actually targeted at the disadvantage that the person is experiencing because of their mental health problem. The next question is whether or not it is reasonable to make those adjustments. And there are a number of considerations that are relevant here. The first one is whether an adjustment would be effective in removing the disadvantage that the person is under, whether it is practicable to make the adjustment. And it might be that, focusing on the question asked, that it is not practicable to expect somebody to be doing a completely different job to their job description. It might not be reasonable to make that adjustment. I hope I haven't spoken around that question too much, but it is a difficult one. But I think you can focus on what the Equality Act actually requires from the employer to deal with it.
Yeah, and Emma's just passed on her thanks then, so that's very helpful. Thank you. Breaking it down into two elements is helpful. Sue's kindly pointed me in the direction of a previous question which I missed. I'm looking to introduce WAPs, for those of you that don't know WAPs, Wellness Action Plans, for all staff as part of our policy. Are there any organisations / employers out there that are currently using them? I know Runa has already shared them with me. Maybe that's something I can answer. Yes, there are a lot of employers that I've spoken with, certainly, that are introduced wellness action plans. And then Katie's made a really good point underneath that as well. She says, yes, we use them. I think it was Mind that released a working from home wellness action plan too. Yep, absolutely. When we went into lockdown, Mind very quickly adapted the existing wellness action plan template into the working from home version. Perhaps I can't actually do it at the moment because I'm screen sharing, but perhaps Runa, if you're there, you could share a link to the working from home wellness action plan, because it's a fantastic tool. Stephen, I don't know if you had any particular opinion on integrating WAPs into policy.
I suppose the only thing that I would say about policy is to mention that they're available, that they're part of the package that's on offer. And again, it's an expression of commitment to the employee's well-being. So
yeah. I think that's a great point about the expression of commitment as well. And it just depends, case by case, whether you want to do it for your organization. We do it personally within Mind, but it's at the employee's discretion as to whether they want to share it publicly or just with their line manager or what have you. There's different ways of doing it. We have them on a shared folder so that colleagues can access them at any one time, and perhaps use them as a way to look out for early warning signs, trigger signs, and just help to better manage our own mental health and well-being. Sorry, Stephen.
Yeah, I've just seen Sue make the point, hope to help all staff well-being, not just mental health. I think she makes a very good point there, because I've talked about the fact that there are legal obligations on the employer when somebody is disabled. One frustration that I have with the Equality Act is that it has the gateway to support, which is you have to fit the definition of disabled before you acquire the right not to be discriminated against, before you acquire the right to reasonable adjustments. If you don't hit that level, if you don't go through that gateway, there's no legal obligation to make those adjustments or not to discriminate. And it is incredibly difficult when you have a mental health problem to be certain that you do reach that standard of disabled person. And a number of reasons for that. People don't like to think, oh, is this going to be around in 12 months' time? People don't like to think of themselves as having long-term conditions. People's GPs don't like to encourage them to think that they're going to have this for 12 months' time. So you have a lot of people who don't think that they're disabled and don't want to think they're disabled, or don't think that they have those protections available to them. So I think one important thing about a policy is a commitment to people's mental health and not just to disability. Sorry, I could have made that point clearer, but Sue's observation just reminded me of that.
Yeah, and I think you've elaborated on that perfectly. So thank you very much. And Runa has now shared that link, which you can hopefully all see, about the working from home wellness action plan. So I would advise taking a look at that, and then perhaps even just doing it for yourself initially. It's a good self-reflective practice to do. And then perhaps if you feel it's appropriate to kind of disseminate that across the organization. Kareem doesn't have a question, but it's just made a point. We use wellness action plans at Greenpeace, where employees/managers approach HR for support. We don't yet have a mental health/wellbeing policy though yet. So perhaps there's one in the pipeline. No questions as yet, but just a quick one from me, if you don't mind, Stephen.
Yeah.
You touched upon the process of involving champions or those with lived experience in the creation or the review of policies. My question, I suppose, is around to what extent would they be involved in that process? There is obviously advantages in doing that. They're the ones that are going to be directly affected potentially by the policies, most of all. But to what extent would they be involved in that process?
To the extent that they're invited to be perfectly honest, and to the extent that they push to be, I suppose would be the answer. I mean, there's no set route to engagement. So I mean, as full as possible is what I'd say.
Okay, perfect. Thank you. We don't have any more questions, but we'll give it a couple of seconds before we move on.
I'm just seeing if I can, yeah, I'm cutting and paste something to putting in chat.
Yeah, we did actually have a request earlier, Stephen, for the quote that you mentioned.
Just put it in, and I will put I've put where it's from as well.
Perfect, thank you. Sue's just made a point here as well. In my own 40+ year working experience, line manager understanding and attitude can be key.
Definitely, absolutely. Yeah.
This goes back to your point, I suppose, about the policies are only as good as the people who implement them at
Yes.
the end of the day, which is
Yeah.
which is a really fair comment.